Well, the first step in investigation is really to take the story, which we call the history, from the patient. And if the story is highly suggestive for angina, one can assume the patient does already have coronary disease. Sometimes we don't need tests to make the diagnosis. However, if we do want to investigate, there are really two groups of tests. The first group is called the non-invasive tests. In other words, we're not putting a tube into the body. And the other is called the invasive tests, where we do steer a tube up into the heart. From my point of view, the most helpful non-invasive test is a CT scan. This is a relatively new development, but we can get really good pictures of the heart arteries without putting a tube into the body. It's an X-ray test using some contrast, and that's a very useful test. The gold standard, however, and the best way of working out if somebody has got disease of the heart arteries is to take a picture of the heart arteries. That's a test called an angiogram. I do most of these via the radial artery, which is the artery at the hand. It's done under local anaesthetic, and the procedure takes 10-15 minutes to do. And it will tell us for sure if there's a narrowing, if there are problems, and what needs to be done.